Echoes of Roman Medicine in the Modern World by Millie Frankel. Let's explore the echoes of Roman medicine in the modern world. From the language doctors speak to the tools that they use, the influence of ancient Rome is still alive in modern medicine. In this presentation, we'll uncover how Latin root words form the backbone of medical terminology, how surgical tools lay the groundwork for instruments we use today, and how prescription abbreviations trace back to Roman practices. We'll also look at the legacy of some of the most popular medical practices that are still used today. Let's trace the ancient origins behind some of the most familiar aspects of modern healthcare. Let's start by breaking down some medical terms used commonly in the medical field today that are derived from Latin and Greek, starting with pulmonary. The word pulmonary means the lungs in English, but when breaking this word down by its root and suffix, we can better understand its origin. The root of pulmonary comes from the Latin word pulmo pulmonis, which means the lung in English. The suffix is "ary," which means relating to in English. So putting these back together, pulmonary technically means relating to the lung. Great, now let's look at the word necrosis. The word necrosis means the localized death of cells or tissues, but diving a bit deeper, we can see what it really means. The root of this word is the Greek word nekros, which means death in English. And the suffix is osis, which means condition, process, or state of. So putting these together, the word necrosis means the condition or state of death. The next medical term we will break down is cardiology. Cardiology means the study of the heart. The root of this word comes from the Greek word kardias, which means the heart. The suffix of this word is logi, which means a branch of learning. When we put this back together, the word means a branch of learning the heart. The next medical term that we will look at is iridectomy. The medical term iridectomy means the removal of part or all of the iris of the eye. But let's break this word down to its Greek and Latin roots. The root of this word is iris, which means the iris. The suffix is ectomy, which means the surgical removal of. Building this word back up, it means the surgical removal of the iris. The final medical term that we will break down is amnioscopy. Amnioscopy means the examination of a fetus using an amnioscope through the cervical canal. The root of this word is amnion, a Greek term which means little lamb or membrane around the fetus. The suffix is scopy, which means to see. Built back up, the word means to see the little lamb or fetus. To further understand the abundance of Latin and Roman influence in our world today, let's dive into the surgical tools that come from ancient Rome and Greece. The first surgical tool that we will be exploring are forceps. In ancient Rome, forceps were made of bronze or iron. They had a fairly sleek and simple design, making them easy and low risk to use, and they were used for extracting foreign objects from the body and handling tissue. This is a photo of what ancient forceps looked like. Surgical forceps today are made with high-grade stainless steel that is heavily sterilized before use. They have locking mechanisms which allow for doctors to relax their hand and be more efficient during these operations. They are mainly used for grasping blood vessels and handling brain tissue, but forceps are seen all over the medical field. Next, we have the scalpel. Scalpels in ancient Rome were designed with a straight, sharp-pointed blade that was made out of possibly bronze or iron. These knives were most commonly used for a range of surgical procedures such as incisions and dissections. Here is what a scalpel in ancient times looked like. Now scalpels are made with high-grade stainless steel and have a variety of safety features ensuring the doctor's safety. They are used for surgical incisions. Next is the vaginal speculum. These were typically made of bone or wood, and they were used to assist during surgeries, not for diagnosis or checkups. This is what a speculum looked like. An extremely similar design to today's, which is made of stainless steel and used for general diagnostic purposes. Lastly, the urinary catheter. In ancient Rome, these devices were employed to address various urological issues, including urinary retention, bladder stones, and urinary tract infection. Roman catheters were commonly crafted from bronze and features distinctive S-shaped designs. Now urinary catheters are made of rubber and silicone and are used to help with urinary retention and bladder infections. As you can see, despite the clear difference in cleanliness, sterilization, and safety of these tools, some of the surgical devices used today are incredibly similar to those used in ancient Rome. Another example of Latin being all around us through medicine is prescription abbreviations. When taking medicine prescribed by a doctor, you often see an RX on the bottle. This RX is an abbreviation from the Latin word recipere, which means to receive or take. But in medical situations, it means recipe. Today, the RX means prescription. In addition to the commonly used RX on the bottles, dosages assigned by your doctor are shown through Latin abbreviations as well. Here are a few examples. QD is an abbreviation for the Latin phrase quoque die, which in English means every day. Another great example would be HS, which is an abbreviation for the Latin phrase ora somni, which means at bedtime. Let's break down a few more examples. PRN is an abbreviation for pro renata, which means as needed. Finally, AC is an abbreviation for antecipum, which means before meals. As you can see, Latin phrases are incorporated to many aspects of prescriptions from doctors and help patients to know when they are to take their medication in order to get better. Next, we will be exploring medical practices from ancient Rome that are still in use today. First, the medical practice of cupping. In ancient Rome, Romans used bronze cups to perform cupping, and there were two main types: wet cupping and dry cupping. Wet cupping was similar to bloodletting and involves making small incisions on the skin to draw out blood and what are believed to be harmful substances. Dry cupping, on the other hand, uses suction to gently pull the skin upward, often combined with this massage to promote healing. Today, cupping is considered a form of alternative or complementary medicine. It's commonly used to relieve pain, reduce inflammation, ease muscle tension, and improve circulation. You'll often see athletes using it. Next is cauterization. The Romans used cauterization extensively in surgery, especially to control bleeding during amputations. It was also a method to prevent spread of infection or tumors, crucial in a time without antibiotics. The Romans would heat up surgical tools in order to perform this medical tactic. Today, cauterization is far more advanced. We now use electrocautery and laser surgery for precision and safety. But the basic principle of using heat to control bleeding and remove harmful tissue is still a core part of modern surgical practice. Romans also gave dental bridges and crowns. They utilized material like ivory and bone, and sometimes even teeth from slaves for dental prosthetics. Dental bridges and implants are still used today to replace missing or rotten teeth, but most are surgically implanted and relatively permanent. These can be made out of porcelain or plastic to resemble a human tooth. As we've seen, ancient Rome and Greece influence in our society today through medicine runs deep. From the language we use to the tools we trust, and even the practices that still guide treatment today, the ancient world continues to echo through every hospital and clinic. Understanding these origins not only gives us a greater appreciation for the history of healthcare, but also reminds us that innovation often builds on the wisdom of the past. Thank you so much, and here are my sources.